So the tumor microenvironment is very important in pancreas cancer, and this relates to our discussion around the stroma. So pancreas cancer is unique in many regards. When we look at a primary tumor, we're not just seeing cancer cells, we're seeing inflammatory cells, we're seeing white cells, we're seeing stroma, we're seeing fibroblasts. We're not seeing a lot of immune cells, and that's a problem. And so part of what we see is this sort of stromal support matrix that nurtures and fosters these cells, but may also provide a physical barrier for effective delivery of therapies. So stromal targeting with hedgehog inhibition, with hyaluronidase inhibition, with anti-metastatic agents such as engineered heparins have unique abilities to try and break down stroma and improve drug delivery, and this concept is being very actively evaluated, as we've discussed, and hopefully within the next year or two we'll have quite a bit of data to adjudicate whether this is meaningful and helpful in terms of treatment approach. There's been some ups and downs, and thus far the downs have been hedgehog inhibition. We've a series of randomized studies which have not supported the use of hedgehog inhibition despite very interesting preclinical data. But there was a lot learnt going back and reviewing the clinical observations and going back to the lab and trying to understand why what was seen in patients wasn't what was seen preclinically, and those experiments have provided additional insight. So this dynamic of conducting clinical trials where there's a very close interface with the lab and the clinic, I think is also really how we can learn from our not successes in a way, but capitalize on getting a better understanding of the fundamental challenges of this disease. So stroma is key, and from the immune targeting approach, there are a variety of antibodies now coming to the clinic that will also target some of these coding agents that may prevent checkpoint inhibitors from accessing tumor cells. So those strategies are starting testing in pancreas cancer, and I think that's very interesting, and we'll have to see how that pans out.